All right. So we should be recording now. And I'd like to welcome everyone to Janae's thesis defense. Very exciting to be at this end of the process. And I'd like to thank both Freddie and Jennifer for your willingness to serve as readers for Janae. It's a very, very helpful process for me because I end up with about 20 theses at it or 30 at a time. And so I can miss things. And so any feedback that others can provide is always very helpful. But at this particular moment, we want to celebrate the fact that Janae's got to this point. So handing it over to you, Janae.
Thank you, Sue. And again, and I also want to thank everyone for being here. It definitely means a lot. Um, I will share my screen and get started now. So the title, oh, well, let me make sure it's shared. Okay. The title of the study is Understanding the Nature of Conversations of Race and Racism in Supervision, Black Music Therapist Perspectives. Um, my main motivations for this research stem from coming from me being a Black music therapy student and a Black person just in education overall. Um, like specifically, like just experiences of just like not seeing like many people, Black people, people of color, like in the field, like going through like undergrad, as well as just like seeing the necessity for more social justice related literature overall to inform the music therapy field and inform music therapy training and just wanting to have more Black voices be represented in the literature and training. Some gaps in literature come from like starting conversations and facilitating conversations of race and racism. There's a lot of literature that focuses on in and out of the music therapy field that focuses on facilitating these conversations, kind of the do's and the don'ts, of course. Some limitations or missing things involve like what does it look like to implement the culturally informed strategies versus just what is there already. But it's common to have suggestions of validating experiences of BIPOC and marginalized people, and also recognize like, okay, some things are harmful, like some responses are harmful when conversations do occur. And typically, whenever the initiation of conversations is referenced, like how conversations are started, usually harm has already occurred to a marginalized person. And since there's like, since it's typical for any music therapy student, like BIPOC or not, to have a white supervisor, I mean, it's especially important to like shine a light on how these supervisors start and facilitate these conversations, kind of trying to shine a light on that. The process that I went through, so recruitment process involved sending out a survey to the Black Music Therapy Network Facebook group. I chose to just specifically use that Facebook group because that is definitely where Black music therapists of like the US tend to connect and find each other. And the survey involved like just checking eligibility, which was making sure that I was recruiting Black music therapists who have experiences as a supervisee and a supervisor, as well as demographic information such as education or region, or what region they work or practice in. And some of the demographics were kept from the paper just to further anonymize participants. After going through eligibility, um, we, um, I ended up with three participants and conducted individual interviews. And going from there throughout the process of data analysis and theme development, there was member checking, starting with the transcriptions of the interviews. So I would transcribe the interviews and send them to each participant, and I followed up to make sure that they were okay with what was with what was being represented in the transcriptions. And once those were okayed, I moved on to using thematic analysis to code and analyze the data. And then when I got to the stage of theme development, I and set and like found some initial themes. I sent them to participants for further member checking to still make sure that this is representative of what they were trying to convey. So this is kind of a overview of the 11 themes that came about from the study. I will not read them all, but as we're going to go through each one, each theme has a few different sub themes as well that like add more nuance to these findings. So the first theme, candid conversations of race and racism are necessary and sought after, was a common theme among all participants. To the right, you see the sub-themes, such as past being afraid about talking about race and racism. There were two participants especially who specifically outright said that they weren't anxious or weren't afraid of or worried about talking about race and racism in supervision settings. Um, and and this included even if like they noticed that the person that they were trying to talk to about it um, was uncomfortable or defensive or not. A quote that I want to highlight here from that's very representative of this is it's just the truth, and a lot of people don't want to hear the truth. And this connects to the second sub theme, uncomfortable truths for the privileged. So noticing that supervisors who come from like very privileged, not very, but privileged identities, such as white supervisors, um, they noticed that they were uncomfortable talking about or trying to facilitate these conversations. And lastly, prioritizing conversations of race and racism. Um, all participants found that participate that it is important and they want to have these conversations. Um, so it's kind of like the ball is in the court of the supervisor of like whether they will be receptive. Recognizing race and in supervision and field work. This came from um, different experiences talked about by the three participants, such as like Black experiences in supervision and field work, basically kind of noting when identity plays a role, specifically identity as a Black person plays a role in supervision and field work. For example, one participant noted that like they were the only Black faculty, only Black person in like the setting that they were working in, and also noted that like they were likely to face more bias because of that and did face more bias because of that. Identifying whiteness in supervision field work. Um, Whenever I was interviewing each participant, they would they would note when they were interacting with a white person, whether it was like a white supervisee. Whenever I asked about experiences of talking about race and racism, one talked about a white supervisee, identifying them as white. Other participants talked about their white supervisors. So just noticing whiteness in supervision and in field work. And also recognizing overall the role of race in field work and supervision, recognizing when it is um, going to come up in some way for better or for worse, whether that's with like one participant noted when there was a only one black client among but a lot of white clients. The quote that I pulled to represent the data was from another participant saying, it just is what it is. This was racialized." Um, Coming from the context of when conversations are ignored or avoided, but it's just there. There was something racial about what occurred and what they're trying to talk about with their supervisor. The next theme, barriers to conversations on race and racism in supervision. One barrier that a participant noted was whether or not they would be understood or just being misunderstood by white supervisors. So the quote saying, "Will it be deeply understood and taken seriously? I'm not always sure of that." Um, and the other sub-theme, missed opportunities by supervisors. A participant talks about advocating for themselves and also trying to bring up experiences of like the bias that they were dealing with from their clients and being, in their words, brushed off by their white supervisor until it escalated to a point where it was very obvious to anyone, including that supervisor. Um, Gaps in culturally informed training. There was one participant especially, but at least, but there's two, but like one especially like noted um, education, like just their experiences in music therapy education. So influences of minimal culturally informed training. Um, Basically noting when I'm gonna gather my thoughts real quick. Um, and this is coming from this suddenly is coming from like minimal culturally informed training of like students specifically, but also supervisors, um, and how this kind of comes from like having minimal culturally informed training in the education setting in the bachelor's programs that are required of music therapists to have a certification. Differences in cultural music knowledge. A participant noted that everyone comes in with like different experiences with music, whether it's um, like what instruments they are used to playing or hearing, what kind of music they are familiar with from their own cultural backgrounds. And depending on the setting of or how the program is structured, some students are going to thrive in that area, thrive in a lot of areas, and some students are not. Um, the participant noted like a lot of the music like that they didn't know their white peers knew, and then vice versa, things that the white peers knew, the participant did know, like jazz and polyrhythms and instrumental um, music. The last sub theme here, personal experiences and identity inform motivation for culturally informed education, comes from the code over here. A student who never heard about race and racism through their 4 years of training is not going to be seeking out a chance to dialogue about their identity unless they have lived experiences that have forced them to consider that or to experience it. I feel like they couldn't have said that better. Um, but yeah, like personal experiences, and my personal experiences definitely informed like what I wanted to learn, which like was to learn to be flexible and learn to be culturally responsive as a music therapist. Another sub-theme, witnessing white fragility and ignorance from supervisors. This was common among all three participants, witnessing white fragility in the form of typically defensiveness, or overall being evasive. One participant did note like a lot of evasiveness, but at the same time, like their white supervisors were trying to kind of locate their cultural identity and their race because they couldn't tell if the participant was black or not. But this participant identifies as mixed race, so black and as far as ignorance, this came in the form of, for example, as I mentioned previously, a participant being brushed off by their supervisor, um, as well as supervisees that the participants had coming to them to learn more Black cultural, like have more cultural knowledge about Black people from a Black person. So kind of acknowledging their own ignorance. I'm gonna take a sip of my water real quick. Sorry. And the quote there, like kind of especially connects to white fragility, but my experience recently has been honestly a lot of fear for my white supervisors when I bring race or racism up. A common experience, especially among two participants, was experiencing harm, which involved white supervisors making ignorant assumptions, such as like trying to locate a participant, as I mentioned before, trying to culturally locate them, racially locate them, without actually like trying to have a conversation with the person about their identity. The next sub-theme, white supervisors ignoring harm done to Black supervisees. I've already referenced a participant's experiences of like trying to advocate for themselves and bring up, hey, this is happening to me and I need support with this, relating to working with majority white clients and being ignored until there was like actual overt rate harm done. And then also a learned expectation of harm. I also mentioned previously a participant talking about how they knew that there was a bias against them from the start of their job. Um, and the quote that represents this, it was kind of brushed off, relates to like how there could have been there could have been steps taken, but it was brushed off and then harm was done. Feelings of isolation was common among participants. Um, Being the only BIPOC person in majority white space, for example, whether that was in work, like occupation, or in like the education spaces. These were brought up as experiences of being the only one or one of few. Recognizing loneliness in others, a participant like recognized a Black client's feelings of loneliness being among only white peers, and also recognize an expectation to assimilate into whiteness, an expectation to act accordingly as far to make white peers, supervisors, supervisees feel more comfortable. The representative quote that I chose was, "So I think because of that, it's just infused into the sharing of I'm the only one in the setting," relating back to isolation. Another thing, being seen, longing to be seen, connects a little bit to that feeling of isolation because, like, there's a one for acceptance, like the sub theme seeking acceptance. The quote that was pulled is in reference to a participant's artifacts. Each participant brought a song that represented their experiences of discussing race and racism to each interview, and we talked about those first. And this participant said, like, the future is not just white, it's everything. Hopefully, everyone feels accepted in, should have the right to feel accepted in everything, both in that story, referencing their song, and in real life. Going back to the top, seeing oneself in the music, this song, this participant um, talking about their song talks about connecting to and relating to the singer themselves, of like wanting that acceptance and also enduring struggles. So that last sub theme, constantly enduring struggles, comes back to that participant relating to the song, relating to like trying to push through these struggles to reach um, an end, which is hopefully acceptance. Benefiting from supervision. So at least two participants no, actually all participants recognize benefiting from the support that they did receive from supervisors. However, the first like sub-theme shows that like there was like careful selection, especially like after leaving higher education, or at least from graduating from their bachelor's programs. They two participants talked about being careful on who they chose to be a supervisor. So one even specifically said, like, yeah, I was careful. And if I felt like I wasn't going to be supported, then I wasn't going to go that way. And another participant talked about having an outside supervisor, like outside of their work, who was Black. Recognizing benefits of supervision. Each participant like talked about having their eyes kind of open to um, how they were how just either open to how they were proceeding in a certain way in supervision. Like, for example, one participant said, well, they specifically said their eyes were open to a lot of new ways to approach a situation that they brought up in supervision, and seeking and receiving support from supervisors. So seeking out and actually receiving genuine and helpful support from the supervisors was a common experience. And a representative quote that I pulled was, so when I think about supervision, I think about the opportunities in which, when I have good supervision, and then it relates back to these sub-themes. Requirements of the supervisor. So this came from all participants again. So having cultural awareness as a supervisor. Um, some participants, like in this quote, they mentioned like so when supervisors were actually aware of identity and comfortable to talk about it with the supervisee. And another participant talked about like them having cultural awareness themselves as a supervisor and bringing that into the supervision and their philosophy of supervision. Acknowledging power and privilege as a supervisor came from a participant who talked about like having like their own power as a supervisor, and like how, and like in a positive sense, the power to do good on the supervisee that they are working with. Supervision approach makes a difference. Another participant talked about flexibility, talked about bringing an approach that works with the person that they're working with, and not just having one set approach to supervision. How supervision starts informs how it ends, came from basically initiating conversations, making sure like there's full informed consent of like, hey, like I focus on cultural responsiveness. Is this something that you are willing to engage in or wanting from your supervision? So making sure that that is upfront and like conversations are started from the get-go of race and racism or multicultural issues. The last theme, growth, um, came from a couple participants. The first theme, sub-theme, growth is uncomfortable, came from a participant that had a supervisee who they responded defensively at first to things related to race, related to their identity as a white person, and how that might interact with clients. Um, and the participant, sorry, the participant later on said that later on they were more receptive. So it was a process of kind of stepping out of their comfort zone. Growth, it takes time, and a willingness to change comes from a couple participants. Um, One is specifically like talked about how emerging clinicians, especially, have a willingness to engage in the culturally responsive training, and like making sure that they have those tools to be able to work with clients or supervisees, or colleagues. Um, and the quote that I pulled from for another participant was, I never one to not share bad stories. I think as a field, we all need to share bad stories, even though it'd be embarrassing because it'll help us all grow. Which was, it's probably like my favorite quote, from the study. So overall implications for the field is, there's a lot of inconsistency in culturally informed training because it's very limited in bachelor's programs, and also like even though there's like standards of practice, and it's in our code of ethics and advanced competencies, like there's no like directive, like no, there's no structure to how, like how much training someone should have or what kind of training someone should have. So everyone is probably like possibly like hopefully seeking supervision on it, but like maybe like just finding some CMTEs, whether it's synchronous or asynchronous. But the inconsistency overall leads to harm to BIPOC students and professionals, to overall marginalized students and professionals in our field, which can come in the form of invalidation, ignorance, passivity, or inaction, or just outright harm from people in question. Some limitations from the research. There were only three participants, um, and while the amount of participants kind of helped with like the method of using interviews, like there was still like the emotional labor that participants experience of sharing these experiences, um, trying to set up times to meet with people that fit, and also there was conversations I had with one participant, especially of like a fear of being recognized from the research, even if it was just being brought here. And also, one size doesn't fit all. This doesn't represent the experiences of every Black person, or every marginalized person. Some personal connections that I had to the research, especially were, the theme of being the only one, those feelings of isolation. And I always think about how it comes back to how it like goes much deeper than just music therapy education. I was the only Black student in my honors classes in high school. I've only had one Black professor in higher education, which was Freddie, um, and only one Black teacher in public education. Uh, Seeking acceptance through assimilation definitely is something that like I didn't really acknowledge until reaching higher education and getting older, that I was trying to kind of fit, the dominant narrative, and feelings, just overall feelings of especially resignation, which definitely like came through, um, what's that I it's something that I noticed with the participants, but that was something that was kind of unsaid in the research. So it didn't become a theme in the research. Moving forward, um, the there needs to be more implementation overall of just the literature, because there's a lot of good literature out there now in our field and outside of our field related to like culturally informed care and practice, and just overall more research on more perspectives of marginalized people. Um, like these both need to happen in kind of in tandem. That that is everything that I had. Thank you.
Thank you for your presentation, Janae. Nicely done. So we are going to move into the next part, which is asking questions, making comments. But very first, I just want to say congratulations on getting that done. Um, I think I'm going to start, if you would don't mind, Freddie, with you. How do you feel about that?
Well, that's fine. Um, First, congratulations. Nicely done. Second, breathe. You did it. You got through it. Um, yeah, something that I was curious about throughout while I was reading and in your presentation now is I was a little curious to know what were some of the questions that like you asked in those interviews, right? Because you mentioned like in the paper you talked a lot about the bringing in of the song, and then the appendix section you had some questions that went with that song choice of bringing that in. But I
Mhm.
found myself really curious about what questions did you bring to the interviews to get some of the responses that you got.
Yes. So like with the artifact, I asked them like in what ways it represented their experiences of like discussing race and racism supervision. Like we listened to to their songs and then I asked that. Um my questions involved like their perspective as a supervisee. Like did they feel like when was the time that they felt comfortable talking about race and racism if there was a time. And then as a supervisor, like what their experiences were talking about race and racism to their supervisees, like discussing that with them. And then the last question was just kind of a general, like, is there anything that they wanted to share about their experiences? Anything further that they wanted to share, which like resulted in some good anecdotes as well.
Gotcha. Thank you. I think it might be helpful to include that in your paper so the reader can get a sense of like what was asked, right? Because I
Okay.
think the responses are really good. But I just found myself asking, I said, how did we get that response? Where'd that come from?
Okay.
I'm also really curious to know, a little bit more about your feelings throughout the process, right? Like you gave us a little bit in the presentation and in the paper about like why this was important to you, like noting that, oftentimes we are the only one of us in our programs, right? Or to hear you say like I'm the only professor you've had that has been of color in your whole experience, which like in my mind I can name as like, oh yeah, that makes sense in music therapy, but it's still to hear it is another thing. And so I think I am always curious to know more about the researcher when it
Hmm.
comes to the research, right? Because you picked this for a reason. Like this was something that felt really personal to you. And so I am curious to know about your feelings during the interviews, like what came up for you or what were you feeling as your participants are sharing their comments, right? I'm even curious to know, like, as you're hearing these people's songs that they're bringing in, how are you responding to the music that they're bringing? Like, how does it resonate with you? What is it making? Um, what is it sparking for you?
Um, I feel like there's, sorry, I'm like gathering my thoughts. I guess like coming to like the songs first, like there's like especially like actually like with the songs, I kind of felt empowered or maybe validated when I was
Mm,
listening to them. Because like I feel like they like their artifacts like for all three participants were similar in the way of like kind of going through it as a Black person, relating to those experiences as a Black person, but also like um but also still like I'm going to get through this type of like response to those experiences. So I kind of like I felt validated and like yeah. But I had another thought. I guess like one thing that I've noticed about myself, I should say, and it's not really a feeling, but it's like I've noticed like prior to this and prior to like my research in undergrad, like I've like learned to push down feelings, push down like reactions to like um injustice, I could say, like or just like or microaggressions that happen to me. And I'm kind of learning to sit with those feelings, and actually like acknowledge, hey, this wasn't okay. Because like what kind of spurred the research in undergrad was actually having a conversation initiated by a white supervisor on race and racism, or basically like a racist encounter that happened to me in field work that I honestly that I didn't really stop at all to process or acknowledge because it was kind of like, okay, this is like a usual Tuesday or something for me. But like my supervisor like asked me if I was okay. It was like, hey, like they definitely like that definitely was a microaggression. I was like, oh yeah, it was. Um, so and like talking with participants, like I think I mentioned this in like discussion, like kind of those like unsaid feelings, like just kind of like I felt like I was holding space for them to like not I mean, obviously, like share for like share enough to like develop themes and talk and like analyze research and all that, but like also like let some things be unsaid because like they're talking to a Black researcher. Um, so that was like I think that's like what encourages me to do this kind of thing because I'm providing them a space that an opportunity that they might not have in research as participants or not have as often.
Mhm. Everything you just said was very beautiful and should go in that paper.
Okay.
I was like, that story is an important story, right? Because there are many other people who have had a story like that who have encountered a microaggression or a macro assault in some cases. And our thing is we just push it down and we're just like, oh, it's just a normal Tuesday, right? But that shouldn't be the normal, right? And it's research that helps illuminate that for people, right? Especially for people who come from dominant groups who don't have that experience. Um, I think something to also um, maybe mention in your discussion section in is the fact that you came into this as a Black researcher, right? And like what that made possible for these participants, as opposed to like if a white person had come and tried to do this research, right? It's important to note that like who you are as the researcher contributed to the results that you got and made it possible, right? And even to add another layer to this, because you know I like layers, is you're not just a Black person, right? Like you have many other identities. Like you're a Black queer person, and there are other ways in which you experience forms of microaggressions that are not just racially specific, right? And so that is another really complex layer to all of this as well that could be worth just making a note of like a little bit in your discussion section, like knowing like, this research um specifically focused on this one identity, but we recognize that people bring a lot of identities into this space. And how does that impact how we view supervision and how, as a person of color, how we even choose whether or not to engage in supervision, right? Because I can imagine experiencing moments in the field or in clinical work where you um, have to deal with these normal day-to-day things that are really harmful, and you don't trust to tell that to a supervisor, or you don't trust to explain those things, right? And I think that's an important element to this idea of trust and who do you give trust to, and why trust feels so inherently important to us as people, but us as Black people or us as marginalized people. Um, yeah, I think the only other thing that was on my mind while I was reading the paper was, you know, when we are able to take classes that deal with supervision, they sometimes will talk through like different theories and models of like how you go about supervision. And so I was interested to know, since these participants were also supervisors or have been supervisors, what were their theoretical orientations? Did they work from, right? Like the cultural piece is at the heart of it, right? And so there's an inherent sense of them bringing that by nature of who they are, right? But I was also curious to know like what other things they may be bringing in, right? Because I think what you highlight is the lack of implementation in education systems, right? And knowing that the educational system is the thing that's really failing because we throw these models at students and we say, okay, there's this model and there's this model and there's this model. But how are we discussing how those things can be culturally informed, right? Or how can we critique how these things aren't culturally informed and how they uphold white supremacist systems and ideologies because they weren't made for people of color. They weren't made with us in mind. So that was the other thought I had, and I don't know if you necessarily have an answer because it might not have come up in conversation, but it was just a curiosity.
I kind of wish I had that as an interview question now, like what their like approaches or like what approach they gravitate towards.
Hmm.
Because only one of them really talked a little bit about briefly about their approach, which like they described as a culturally humble stance.
Hmm. Yeah, and that could be something you put in like a future research. Like if I were to do this again, I might
Yeah.
ask this question, or I might include some of these thoughts now having done it and seeing where maybe there's some gaps or some questions that were sparked for me in hindsight.
Hmm.
I just want to jump in a little bit just so I don't forget. So, Freddie, when you say to put more of Janae's story in it, would you like that as like final reflections at the end of sort of the discussion before going into the limitations and future research? You said in the discussion, but I'm wondering whether, it goes there, or would you like it in the methods section, talking about
Mhm.
how, um, you know, having the same standpoint was an asset? Um, I mean, I
Mhm.
think that's important. The second thing I wanted to say is I was going to bring in the thesis that Jess Newman did, which is what I put in the chat, which was queer clients' experiences of harm in therapy. And that you might be able to draw in when you're talking also about, like in your reflections, maybe, or maybe in the part where in the discussion where you're talking about harm, where you complicate that sometimes people have multiple identities, and while you found all of these things in this other person found that queer clients experience harm because of, and very, you can have a look at the themes that came up, but some similar themes, right? And there might even be ways, I don't know, Freddie, maybe if Janae took a look at your thesis where you talk about, and I think you do that towards the end of the discussion, is where you talk about how having the same identity as a queer Black man as the people that you were interviewing, like how that, oh, sorry, not interviewing. Well, you were interviewing them afterwards, but who you were working with. Um, Maybe that would be a good um, example of how to talk about that.
Yeah,
I'm not
I
sure.
think I think it can be. I think there's ways to put it in different spots, right? So I think there might be room because Janae has a section in their paper where they situate themselves, like towards the beginning, and that could be a part, that could maybe be a position to discuss. that story that they experienced in school, right, with the supervisor. And if not in that section, the section where they discuss sort of the reasonings for this research, like that story could go in that reason section, right? And then that could be used towards the end and kind of brought back to kind of say, like, because I have this identity and have experienced this firsthand, it was very influential in how I structured these interviews. It was purposeful why I did member checking at every step along the way to make sure that no one was feeling like they were being put at risk, right? So I think that is my thought, is like maybe there's a part for like the specific story itself to go towards like the purpose or the reason for the research, and then bringing back in the discussion, kind of tying it all together in a nice little bow and saying all of these things together, and me being who I am is why this research was made possible and why it was done in the ways that it was done and why it was able to garner the information that it garnered. Whereas if a white person had done this, it is not guaranteed that the same care could have been taken because they don't have the experience to support why those choices were made.
Yeah, and then the other quick thing, and lucky you're going to have the recording so you can listen back to it multiple times. But when Freddie was talking about the theoretical framework of the participants in terms of supervision, I was wondering whether either in one of the stories towards the beginning or in the lit review, whether you want to talk about the experience of um, engaging with um, the supervision book that we engaged in, the outside of music therapy one that's all about culturally, I think they call it sensitive, but supervision approaches, like whether you want to bring in something about that into, you know, woven into the story somewhere, to talk about the Hardy and Bopes book, maybe. That was just a
Yeah,
thought that came to me.
yeah, I'll make sure to look at the reread those portions.
Yeah. Okay.
Again, nicely done, Janae. Congratulations. That's all I have.
Thank
Oh,
you.
and in your story, like when you talk, sorry, there was another part of that, and Freddie's voice reminded me. So part of it is the story that you had that book, but part of it is that you had Freddie as a supervisor. Um, you know,
Mm.
Hmm.
and what was that like?
Woo-hoo.
I mean,
What was that like?
and I'm not asking you to say that right now, but but the fact that, finally you had, you know, I don't know, like
Yeah,
maybe that's important to sort of pop in there.
I didn't think about that. But yeah.
Jen, Jennifer.
I have 5,000 questions because I could talk about your research for the rest of the evening, but I won't put you through that. Um, I think what struck me was the growth. I'm going to tear up of working with you on your first paper and you inviting me to be on that journey. I grew immensely from being a part of your research, and to see where it's come, it's just stunning. And I remember when we presented at the conference, I asked, who is your audience? Is it the Black music therapist, or is it the white music therapist, or is it both of us that need to hear? We all need to hear it, but who are you talking to? And I feel you're talking to all of us, but I very much hear like what Freddie's telling you, that it's coming from your place as a Black person in this field, and that still shines through in such a relevant way. I have all these little notes on the margins of questions, but the one thing that caught me was the same thing Freddie was talking about was with the music. I wondered if the participants would feel exposed if the exact titles or artists were mentioned. I don't know if they would or wouldn't. It'd be interesting to know what that music was.
Yeah, it would be really nice too, but like one of them, it's their original song.
Okay, that makes sense. Totally makes sense that that would not be included. But I did notice that I don't know the number of the theme, but being seen, longing to be seen, the being seen, that a theme really seems to come more from the music and dialogue about the music than all the surrounding parts of the other conversations. What do you make of that?
I guess like my first thoughts is like that was maybe even prior to coming into like those experiences and the programs that they were in, like that what music was a form of coping, a form of expression, and still is. And it became especially relevant for them going into programs where they um were the only one or one of few like um but yeah, definitely like with like being able to have a sense of self
Mhm.
through those times.
Yeah, I noticed the hopefulness in that theme associated with people talking about their music. And that very much stood out to me. And I was like, what was the music? But I totally understand avoiding an original song would be very exposing. I'm always interested with researchers of the recruiting process, um, which can be challenging and lengthy. And a unique set of people that you needed who had both supervisory experience themselves and had an opportunity to be supervised, which is a little easier because we all come through particularly our undergraduate training with supervisors. Graduate training should have supervision. Some programs have stronger roles in supervision than others. What was that like trying to find these folks to participate?
I would agree that it was a lengthy process, because like especially at first, like I wanted to do a focus group, and that was realizing that that was not going to be possible, and then just coming back and like deciding, okay, we'll do interviews, with the same questions but more individualized. Um, but yeah, I definitely like had to post like a few times on Black Music Therapy Network, before I got to three people. I was hoping for for a couple more than that, but I was appreciative of who for the people who who decided to participate. Um, does that answer your question or?
Yeah, I mean, with all research, it can be challenging to get participants for all of those reasons. We're busy. We have a very defined group of personal characteristics. And then you already have a smaller sample size to start with, and you're asking difficult questions, which may also kind of have people pull back. So I think it's in the three people you have, what I noted, I said, very experienced and highly educated. And that's a different group than music therapy students that you interviewed before. And I was just curious to what degree this older, more experienced master's degreed group of people, how their stories were similar, different than the group of younger college students in those same stories. Were there, just how did those align or differ in any way?
I feel like I noticed difference first, especially when I got th I like conducted all the interviews. Like a main difference that I noticed is like how like the theme past being afraid of talking about race and racism, like there wasn't really a mention of fear of like backlash or retaliation. They whether it came from just like being empowered, whether it came from kind of a resignation, they were my participants for this study were ready and willing to talk about race and racism, even if the other person was not ready, like the supervisor was not ready. Versus like with the students, like they're college students in a bachelor's program coming out of high school. And like there's that fear of like and that experience of retaliation that they experience. Um, so that was a big thing that I noticed. Some similarities, like definitely like isolation between all of them. And it was interesting to note that not like the experiences of like them like my most recent participants like they talked about how they benefited from supervision and also talked about like at least in some way being validated and supported where that was like not as common with the college students that I worked with or
Yeah.
interviewed.
Yeah, and certainly the dynamics of student professor who may also be a supervisor having you're grading their progress, that changes the power dynamic than if you are in your professional career, you have some more power in do I stay or do I go versus I'm going to finish this degree and just push down whatever has to be pushed to get to the other side. I wondered too if the participants, because talking about that maturity and that life experience and master's degree, clinical practice, all of those, combined experiences, were people in their interviews still reflecting back to early supervisory experiences?
I feel like they were reflecting on more recent experiences, like especially in like work. Um, well, actually, I did have one participant that reflected on their early experiences, yes, actually. But the majority, which was like the three of them, like they also focused on like more recent supervisors or more recent like experiences as supervisors. Um, and also I just remembered another like difference was like they did acknowledge well I guess they all did kind of acknowledge looking back like by like acknowledging like the kind of education they received, the quality of education they received from bachelor's program.
Yeah, because that very much impacts those of us who teach, and the weight of those early supervisory experiences for Black students with predominantly white supervisor teachers. It was like I was just curious for my own self of where were these older, more seasoned supervisors, were how much impact were those perhaps early negative experiences. I think some of it came out with, I'll say it now, I feel more comfortable bringing up these
Hmm.
topics now that I'm older, have more education, have more clinical experience, and I'm not tied to this, I can't graduate without you assigning me off experience. But I was just curious of how that time and space and maturity helped or changed their how they talk to you in their interviews. So
Yeah.
I also wonder if because the criteria for inclusion was that they had been supervisors as well as supervisees, whether becoming a supervisor sort of made it like, oh yeah, I'm not holding back now when I'm in supervision, like, you know, because they've now been that, you know, like I think I'd be a better student now that I've been an educator than I was, you know. Um, Not that I would be less combative, but that I would bring a different probably a different confidence, right? And I wonder if there's something about that too. I also wonder if there is something about the work that they've each done personally in terms of where they are in their racial identity development compared to maybe, an undergrad student who may be in another space of yeah. I think there's many reasons, but I think those are things to also consider maybe.
Yeah. And to answer your question, Freddie, like, I think most of them didn't specify. There was only like one time where I could definitely confirm, like, okay, this was a music therapist. This was because it was like in their bachelor's program. Um, but yeah, they like said supervisors. They didn't really say music therapy supervisors.
Yeah, just the topic of supervision alone in music therapy is a conversation we have to keep having on what is it, how does it look different if you're a sophomore in college versus your 5th year in clinical practice versus your 20th year in clinical practice. And we haven't talked about that enough. And I know I was appreciating the outside of music therapy supervision literature because psychologists have a leg up on us on articulating that. And just a plug from the commission years, we talked so much about supervision, and it's the fact that we don't have enough systematic ways to train future supervisors if music therapists can practice with a bachelor's degree. Because people say, well, then we need a class on supervision. And we're like, in the undergrad? It's like, no, they're like, you don't have your clinical identity formed yet. How on earth can you consider training? But still, there's an aspect of culturally informed practice and culturally sensitive practice that definitely is part of the undergraduate MTBC training. And we're still not succeeding at that, but we shall keep trying.
Maybe a requirement of a grad course in supervision is still required for people, even if they don't do a master's degree. Maybe they can at least do a graduate course in supervision before supervising. Just a thought.
Or certification requirements, continuing education certification requirement on.
Yeah, but more than a 5-hour one.
Yes, yeah. Because that was one of your questions, that was one of your prompts, Janae, of we have these courses that are popping up, but we don't have very rich data on the impact.
Yeah.
Of additional courses. Thought that was really interesting. And that's a real doable thing. There could be follow-up from certification board on impact of attendees.
Yeah. I'd be interested in that, like in seeing that data, that kind of data.
I had a little reflection when Jennifer, when you were bringing up the thing about the music, and what came to my mind, Janae, was, and it might be because George has the 3rd edition of a book coming out, and so I've been like rereading parts that he's changing. But I was thinking about how when Black people were enslaved, right? They were ripped away from their mothers. They were ripped away from family, right? Those ties were taken. And music was always still there, right? That was really important. But I was thinking, when Black people come into music therapy, they're ripped away from the music, right? Which is analogous to being ripped away from one's mother or from one's family, or right. And then the thing that was always there is there, but not in that space, right? But yeah, that just sort of came up to me. I was like, that's really big image when you were talking. So, which sort of makes it obvious why they're seen in the music that they bring in. Right.
Yeah.
Anyway, just thinking about it. Narratives, that sort of through lines, of narratives. Any other of your 1 million questions, Jennifer? I don't think we'll have time for all 1 million.
I did notice your comments on curriculum and building towards people's strengths. And I think this is a little bit about what Susan's talking about, that a lot of us, when we come to the School of Music, we leave certain aspects of our music behind to do the one thing, to do the orchestra thing, instead of making the music the way you want to for your own sake, right? We have to sacrifice some of that. What advice, if any, would you have to colleges, schools of music on changing entrance criteria for future music therapists?
Even before I said interest criteria, I was thinking about interest criteria. Like I feel like at the very least there needs to be different entrance criteria for music therapy students, people who know that they're going to go into that program. Like maybe letting them audition with like maybe one outside music faculty and then music therapy staff, so that they can come in with like whatever music that they have, um, and just share, this is who I am. That would definitely like help show strengths. Um, and maybe do some site rating of something like, um, but that's like the first thing that comes to mind, like definitely like with entrance criteria. And I feel like it runs like much deeper than that too, because like in high school and middle school, like that's already like has barriers for BIPOC people to like even engage in that. Like I was fortunate to have like to like have the economic standing with my family to be able to have a violin, to like have my family buy me a new violin and play an orchestra, and then also learn about, okay, there's different music schools and like this is how you audition for them. Um, but I guess like if entrance criteria is also changed to like specifically like having a person like bring in their own music to perform for music therapy staff, like then also outreach needs to be had to not just the bands, choirs and stuff, but to more like more community, just like high school in general, like visiting high school classes in general, like maybe like an assembly like for like seniors in general or something. So like that as well would need to be encouraged to like get like more like a more diverse population of students of
Yeah, we have a recruiting bias because we go to the ensembles in the high schools.
Mhm.
We don't go to the community centers or the churches or the people DJing in clubs or people's garages just pulling together musicians. We don't tell those people you can have a career as a musician in music therapy. We only go to the high school choir and recruit the people who can read music proficiently. But that is a whole nother soapbox.
Mhm.
But yeah, we're not finding the people in the places where we can invite them to be part of the profession.
We also have to move away from the ensembles that we offer. And the way theory is taught, like there's no need to teach it that way.
Yeah.
You can teach theory in a completely, I mean, we're changing our curriculum because we've got someone in who cares about it, for theory, and we're changing where we now have 4 3-credit courses that we're hoping to start next year that are integrated musicking across context, and taking away them having to take arranging and orchestration or conducting or all these other little things, but like integrating it all in less classical terms and more contemporary music terms, hopefully with a wide variety of that, but it depends. But at least it's sort of moving more in that direction.
And it's educator resources that as we bring up the next generation of music professors in music therapy and without, hopefully they're also building a skill set that is distinctly different than the people that taught us. Because I can say I want to learn jazz piano, and my classically trained piano teacher will say, I can't teach you that. And I'm like, okay, I guess Mozart it is, because that's what you're capable of teaching me. I need this credit, even though I want to learn something else. There isn't anyone to teach me. So we perpetuate the circle until we bring up more people with more diverse music backgrounds into the college level. But again, I digress.
Mm-hmm.
Janae, I wondered too, with your now expertise as a researcher, can you see being a supervisor in a music therapy clinical context that serves Black and marginalized music therapists?
That is definitely a goal that I have in mind. Like, I definitely want to be like at the very least start like working in the like with Black and BIPOC marginalized clients in community, and also like being a supervisor for the same community as well. But yeah.
Yeah. That's what all this is working towards.
Yeah.
Unfortunately, research is not necessarily a financially lucrative outcome, but clinical practice, there is certainly a need.
Yeah.
The world is your oyster.
Yeah.
Janae and Freddie are not far apart. They seem like they are right now because they're in different houses and on different Zooms, but they're really not that far apart, are you?
Janae's just down the street. Or rather, I'm down the street from their job. So
Yeah, yeah.
All right. Well, Janae, do you have any questions for us? As I've told you, no rush on your revisions. Just it won't get loaded into the library system until you're happy with that. Hopefully that you'll get both written and this, like if anybody's written anything in your actual thesis, they can send it to you and you can have a look at that feedback. And then you've got this to listen back to.
I don't think I have any questions because like I just have like a lot to think about now. A lot of good things to think about. So
Yeah, and I'm excited. I know it was hard to get enough participants. But that is a problem for all of us. But I do think that you got some good people, and I do understand the difficulties. I wonder if, given that both readers were hoping to know a little bit more about the music, and we can't do that, I wonder if there's without throwing that person under the bus, saying, given that some of the pieces were original, like, I don't know, maybe there's something like that. that you're not sharing that, but that it was a significant.
Yeah, just like kind of emphasizing that it was.
Yeah.
Yeah.
But that or you don't even have to say because some of it was original, but maybe because in order to maintain the anonymity of the participants, you're not sharing what songs that they shared because that could do that.
Yeah. Oh, yeah, I see what you mean. Okay.
Just in an even more clear sort of way. But
Yeah.
hopefully we can get this to a point where you can submit it somewhere and see how that goes.
Yeah.
All right. Well, thank you again, everyone, for your close reading and for your great questions and comments. And congratulations, Janae, you now have your master's degree. And we're very excited about that. And good luck with the next parts of your journey.
Thank you. Thank you, everyone.
Congrats, Janae.
All right. And it's so nice that it's a special group of people from your beginning to your current.
I know. I was thinking when I popped in, I was like, I remember when Janae sent me an email when they were interested in joining this program, and now
Yeah.
they're graduating.
Yeah.
And on our Facebook feed this week, we had a memory pop up, and it was you singing "We Are the Dinosaurs" and
Oh.
leading with a group of little 4-year-olds. And I was like, oh, and now I am observing her master's thesis, your master's thesis defense within the same window of pop up. And I was like, it just serendipity. It just popped up. And I was like, oh my goodness. And now you have a master's degree.
Yeah, time flew.